All right, good morning, everybody. Here on this Monday, we're going to talk a little bit about some financial assistance programs when it comes to Medicare. If everybody will, please remember, if you have not already, to put your name down in the chat just as a little bit of a sign-in sheet, since we are unable to do any in-person presentations. That will serve as sort of our sign-in sheet for all of these presentations, and I do appreciate that very much. My name is Ryan Ramsey. I am the SHIP director here for the state of Tennessee. Before we talk about some of these financial assistance programs, we're going to talk a little bit about the annual enrollment period, as well as a little bit about SHIP. Some of the things that we'll talk about, aside from the program background, like I just said, is about these Medicare savings programs, about extra help, and then some question and answer time as well. So right now we are in the annual enrollment period. And what is the annual enrollment period, or AEP? Some people may also refer to this as open enrollment. The open enrollment period is the time which comes around every year where you can join or switch a Medicare prescription drug plan. You can join or switch a Medicare Advantage plan, and you can switch from a Medicare Advantage plan back to original Medicare and either pick up a prescription drug plan or go without coverage. The annual enrollment period does last from October the 15th through December the 7th of each year. And what you should do during this time is take time to review your current plan. Everyone should receive their annual notice of change in September of each year of how that plan will be operating the following year. So take time to review that annual notice of change to see how your current plan will be changing next year, and take time to review other health and drug plan choices that will be available to you next year. If you do choose another plan, you can enroll in that plan that fits your needs. That plan will start as of January the 1st of the following year. However, if you do not choose to change plans and you do choose to stay within your current plan, that is perfectly fine. That will auto enroll you into the same plan the following year. In order to make sure and have all your cards prior to that, we do recommend trying to get signed up by the end of November. However, you do have until December the 7th to make any of those changes. So it is a little bit longer than that, but just to make sure that you have all your cards in hand, as those can take, roughly about 17 to 21 days. It's usually a pretty good idea to try and have that accomplished prior to December and not wait until the last minute to take care of all of that. And why this, what our program can do. Tennessee SHIP, that's the State Health Insurance Assistance Program. We have trained counselors available throughout Tennessee that can help people do comparisons of prescription drug plans, Medicare Advantage plans, Medigap policies that we do not only during the annual enrollment period, but all year. What I like to tell people is we're free and non-biased. We do not work for or represent any insurance company, and we don't even like to give the impression of partnering with any insurance company. We represent the beneficiaries and try to help them find the plans that will cover their needs the best for the lowest cost overall for the year. We also do help screen people for some of these financial assistance programs like the Medicare savings programs or extra help. Those programs are run through separate entities, but we do screen people and help them go through those applications if they do ask for our assistance as well. And then we do not only provide one-on-one counseling, but we also do outreach. So we'll do presentations, health fairs, enrollment events on years not this year withstanding. 2020 has been kind of a wild year that we've not been able to do a lot of our outreach, but normally we do hold enrollment events throughout each of our regions statewide where people can set up appointments to come and get face-to-face counseling with somebody to help review those. But all of that can be taken care of over the phone, so nobody has to feel like they could not get the same assistance over the phone or through email as they do from person to person. You can get in contact with Tennessee SHIP by either calling our toll-free hotline, that's 1-877-801-0044, or you can email tn.ship@tn.gov. You may also go to the State of Tennessee website. That'll be tn.gov /aging. Will take you to the Tennessee Commission on Aging and Disability, and you'll see on there, if you click where it says Medicare assistance, you will be able to access our online fillable form that will come straight to that tn.ship email as well. Now, it's important to understand the difference between Medicare versus Medicaid. When it comes to the difference between those two programs, the reason why we bring this up is that the Medicare savings programs are technically a Medicaid program. That means that these programs, the Medicare savings programs, are run through TennCare. TennCare is the person who administers those programs, which is the state of Tennessee's Medicaid program. Now, just a difference between Medicare versus Medicaid. Medicare is the national program that is consistent across the country. It is administered by the federal government. It is health insurance for people who meet one of at least 3 criteria. That being who've aged into 65, that means they're 65 or older. If they are below the age of 65, they must be on Social Security disability benefits, that's SSDI benefits, for at least 24 months. As of the 25th month, they become Medicare eligible. Or if they've got certain disabling disabilities, such as end-stage renal disease or Lou Gehrig's disease, also known as ALS. Medicare is also the nation's primary payer of inpatient hospital services to the disabled, elderly, and people with ESRD or ALS, that's end-stage renal disease. Whereas Medicaid, on the other hand, are statewide programs that vary among state to state. They are administered by state government within the federal rules, so there's a federal and state partnership there. And it is health insurance for people based on need, both financial and non-financial requirements. Medicaid is also the nation's primary public payer of acute health care, mental health, and long-term care services. So what we're going to do right now is talk about the Medicare savings programs, and then once we've gone through the slides of the Medicare savings programs, I'll go ahead and show everybody what that application for these programs look like. So with the Medicare savings programs, they consist of 3 sort of sub-programs within the big umbrella of what is a Medicare savings program. You'll hear these commonly referred to as MSPs, just by people who are using, sort of those acronyms to concisely describe those. The 3 programs are Qualified Medicare Beneficiary, or QMB, Specified Low Income Medicare Beneficiary, or SLMB, or or qualifying individual 1, which is also known as QI1. Why is there a 1 at the end? Why couldn't you just say qualifying individual? Nobody asked me when they were coming up with the names. So the Medicare savings programs. These are programs that Medicare beneficiaries may qualify through TennCare, like I stated earlier, for programs that may help pay for their Medicare Part A and Part B premiums, deductibles, and or coinsurance costs. So depending on which program you qualify for, it will pay for your Part A premium, your Part B premium, and all the copays and deductibles that go along with Part A and Part B. They are based solely on income. That's based on the 2020 federal poverty level guidelines. There is a $20 unearned income disregard that is included in those income figures, and there is a $1,500 per person additional limit that can be included for each person based on having an individual burial account right there. And then right here it says choices, recipients do not qualify for QI1 automatically. Choices is another TennCare program. That program is focused on long-term care. It is essentially for people who qualify for care in a nursing home but choose to remain in their own home. Just because you qualify for choices does not mean that you're automatically qualified for a Medicare savings program. If you did not apply for a Medicare savings program in addition to choices, you will have to reapply for one of those Medicare savings programs. Qualified Medicare beneficiaries, or QMB. QMB is the one that when people call and they're looking for financial assistance that they typically are asking about. QMB is what most people would view as sort of the closest thing to traditional Medicaid or traditional TennCare. Payments for Part B premiums and payments for Part A premiums, that would be your premiums, your deductibles, and your copays would all be paid under QMB. Now, the income and resource limits, we'll go into that. Income is based on how much money do you receive before anything gets deducted from your check. So before they take out any of your premiums, before you pay your rent, before anything like this, it is solely based off of what is your income limit. For a single person, that figure is $1,084 a month. For a married couple, that figure is $1,457 a month to qualify for QMB. Now, your resources will include any savings, investments, real estate, not including your primary home that you may own. For a single person, you must have less than $7,860 in your total resources. For a married couple, you must have less than $11,800 in your resources. I did say any real estate, and that does not include your primary home. For example, if you did have, say, your house was on 10 acres, they're going to disregard that. That is your primary home. But if, for example, you have a number of different properties that's not connected to your primary home, then they would start counting real estate in that case. So, for example, if I lived, you know, in a house on 1 acre, but you know, down the road, I owned another family member's home, and that was sitting on some land, they would count that against me. And they do have a look-back period as well. So a lot of people think that they can just transfer those things out of their names, but unfortunately, no. They will have a look-back period of, I believe it is a 5-year look-back period. they also do not include your primary vehicles. So if, for example, you're a married couple and you own 2 vehicles, neither one of those vehicles are counted because you can count one primary vehicle for each adult in the household. But for example, for the retired man who may fix up classic cars, and so he's got his primary vehicle, but he's also got 3 cars on his lot that he's been kind of, you know, keeping in good shape or repairing, they will count something like that against someone. The second program, Specified Low Income Medicare Beneficiary, or SLMB. This is the step down from QMB. What they will do is that they will pay your Part B premium, but they will not pay for any of your copays or deductibles if you qualify for SLMB. The resource and income limits right here are for a single person, $1,296, and for a married couple, $1,744. Those same resource limits will apply on all the Medicare savings programs. That being, a single person can have up to $7,860, and a married couple can have up to $11,800. The third program is Qualifying Individual 1, or QI1. This will do the same thing that SLMB does. It pays your Part B premium, but does not pay the copays and deductibles. The difference with QI1 is that essentially each year the state has so much money that they can pay towards this program, QI1. And once those funds have gone, they can no longer take anybody onto the program. Therefore, essentially there are a select number of spots or a number of people who can qualify for QI1 in any given year. So, you know, if you're looking early in the year, if it's January, February, March, you stand a pretty good chance if somebody's trying to qualify for QI1 that they might be able to qualify and start receiving QI1. Once you do sort of get into the later parts of the year, like right now, the likelihood of somebody being able to qualify for QI1 does decrease by a lot, just because a lot of those slots will be filled up by this time in the year. The income limit for a single person is $1,456. For a married couple, that is $1,960. And those resource limits are the same, $7,860 for an individual, $11,800 for a married couple. And how to apply? To apply for a Medicare savings program, essentially there are 3 ways that you can do that. First of which is you can always call Tennessee SHIP. If you call 1-877-801-0044, you will speak to one of our call center representatives who will give your information, your name and information to the coordinator in your region of the state, and they will give you a call to help you complete one of these applications. You can, we will complete that application over the phone on a paper application, or we can help somebody go to tencareconnect.tn.gov/services/homepage, this link right here. I'll go ahead and click this. It does seem to sometimes take a few minutes to pull up that page, or it can at times. I'm going to stop sharing this really quickly here just so I can share and make sure that I'm showing everybody the correct screen here. Yes, this website right here, if you go to TennCare Connect, you can see apply now or create an account. If you create an account on this website, you'll be able to apply online, as opposed to the paper application, which you can in fact also complete. I will show you this. They did a update on their application process starting about midway through last year, that rather than having an application solely based for the Choices program or for Medicare Savings program, they've consolidated all those programs into one application. So this is a 16-page application that TennCare uses, and if you just scroll down through this application, you'll see some information about what they're going to ask and what you're going to need, where to return this application to, and other ways to apply, such as the website there. And then some information about help completing this application. But again, you can always call Tennessee SHIP. We're always very willing to help anybody complete these applications. If you scroll down to page 3 here, there's some information. Tell us about yourself, name, address, zip code, mailing address if different than your home address. Tell us about your family. It does include who you will include and won't include on this application. You know, information about an additional person in your household, that being like a spouse, or if you have any adult relatives, any children under 21 who live with you. So you'll include everyone in your household right there, and you'll just, if you only have yourself living in your household, obviously you just skip through these additional people here. To step 3, tell us about your family's coverage. You'll include any additional things that you have, things like annuities, bonds, key accounts, checking accounts, health reimbursement accounts, pensions, savings, trust funds, anything like that. You'll list all of that information there. Any more information about your property, your home, life insurance, any vehicles that you have, you'll include all of that information right here. And then you'll read all of the things that you're agreeing with, your right to privacy. They do ask about voter registration, so they can send you voter registration if you so choose. And then you have the opportunity to put, you have my permission to try and renew eligibility for a number of years. And then once you complete all of that, you'll sign and date that information. And then we would, once we've gotten your signature and date on there, if you're not able to sign, then we would obviously complete everything we can and mail that to you for you to sign and date that, and either mail in yourself or mail back to us, and we would fax that in. If you do the paper application, TennCare, from the date that they receive that, has 45 business days to render a decision on that application. So it is about a 9-week process from once TennCare has received it. So I usually tell people it's about an 11-week process. It takes about a week from when you send it in for TennCare to receive it. TennCare has 9 weeks from that point, and then it takes about a week for them to mail their letter with their determination on that. With those paper applications, we do tend to see those determinations go the full 45 business days. However, if you do the online account, it has been much faster, at least in my experience. When I did have a meeting with TennCare, they told me that they were able to address these within about 24 to 48 hours. I've not had anybody report to me, at least since we've been using the online application method, that they did receive some sort of notification back within 48 hours of their eligibility, but it has been considerably less time consuming through that online portal, just in terms of people receiving their eligibility determination in a much more timely manner. Aside from Medicare savings programs, which again, Medicare savings programs are administered through TennCare, and they help pay with your Part A and B costs. You know, QMB will cover your Part A and B premiums as well as your copays and deductibles. SLMB only covers your Part B premium, as well as QI1 only covers your Part B premium. Now, changing directions, the Extra Help program is a program for prescription assistance. So rather than your hospital and doctor assistance, Extra Help is for prescriptions. The Extra Help program, or the Low Income Subsidy, LIS program, is administered through the Social Security Administration. So you would go through the Social Security Administration to qualify for the Extra Help program. The Extra Help program will help lower the cost of your Medicare prescription drug plans by reducing your plan premiums, your deductibles, and your drug copays. For a single individual, your monthly income before anything's deducted, it has to be less than $1,595. And for a married couple, it must be less than $2,155 a month. From time to time, I do have people who will call and say, well, I received this much, but I have to pay, you know, a mortgage, or I have to pay my, you know, auto insurance, and I have a, you know, a car payment that I have to make, and then there's my rent, and they're not concerned with those things. It's just solely based off of what your income is. The resource limits are also higher when it comes to Extra Help. That would be your savings, investments, and real estate, not including your primary home. For a single person, you have to have less than $14,610. For a married couple, it has to be less than $29,160. And qualifying for Extra Help, you will automatically qualify for Extra Help if you have full Medicaid coverage, if you receive supplemental security income, that's SSI, or if you have already qualified for a Medicare savings program like QMB, SLMB, or QI1. You can automatically qualify for Extra Help. All others must apply. Again, you can call Tennessee SHIP at 1-877-801-0044. You can call the Social Security Administration, and they can help you apply. We do have a good relationship with Social Security, so they may refer you to Tennessee SHIP regardless. You can, once the Social Security offices in your region have reopened, you can go to the Social Security Administration and apply in person, or you can go to ssa.gov/extra help at the Social Security Administration's website, and do that application face to face, or excuse me, through the website. I did click on that. It does seem to be trying to pull up some information, but while the computer's thinking here, while the computer is pulling this information up here, I just wanted to show everybody sort of what extra help will pay for. If you're receiving full extra help, what they will do is they will help pay a certain amount towards your monthly premium. What they'll do is they pay the annual beneficiary premium. It's an amount that they set each year based on what the average premium that somebody pays for when it comes to prescription drug coverage. I mean, what they'll do is they'll pay up to that amount towards your Part D, as in drugs, premium. They will also set maximums for what you'll pay for your medication, so you'll never pay more than $3.60 for any generic medication. You'll never pay more than $8.95 for any brand name medication. And then they will also cut down your deductible. If you've got full extra help, you'll have no deductible there. If you've got partial extra help, they'll pay partially towards your premium. You'll have a partial deductible. And then what they'll do is they'll set a percentage that you're responsible for your medication in that case. And while I was talking there, so if you go to Social Security's website, and you don't necessarily have to do anything in particular. If you do extra help and search that, it should be, one of the first thing that comes up on Google. It'll be extra help, and it'll take you to that exact same page. If you click apply for extra help, then you'll go through this information. If you hit apply now, then you get started on this application process. It's going to ask you a lot of the same stuff that Medicare Savings Program application asked you about. It's going to ask you how you heard about that, if you've got Medicare, if you've got less than what your resource limit is, your marital status, how much you've got in your savings, what's your monthly income, do you have any other investments, real estate, do you have a pension, do you have an IRA, those sorts of things. They're going to ask you all those same questions. It is not a long process. Usually it takes somewhere between about 5 to 10 minutes to complete one of these applications. The TennCare application can take a little bit longer because they do ask for more information in there that typically people don't keep on hand, like, if they've got any sort of life insurance policy, if they've got burial contracts, anything like that. They do typically ask for who you've got that through, and people may have to go and search that information a little bit more than this. But that application process is fairly quick. Once Social Security receives that application, they usually render a decision somewhere between about 14 to 21 days. So it is a little bit quicker of a process than the TennCare application can be. Now, I do want to take some time to make sure and answer any questions. So if anybody does have any questions, if you'd like to either raise your hand or put that question in the chat, then I'll absolutely unmute you and let you ask your question. Okay, I'm not seeing any questions in the chat here. There was a question, will this information be sent out? Yes, you will receive a copy of this presentation and this information after we are done with this presentation today. You're very welcome. All right, Evelyn, I have unmuted you. I believe you had your hand up. Do you have a question? If not, okay. We'll give everybody a couple more seconds if anybody has any questions to raise their hand or put it in the chat. Okay, I don't see any more questions, so I'm going to go ahead and stop our recording.